Hello, my name is Hannah Hlund, and today I will be talking about postpartum depression. So, first, what is postpartum depression? So, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, defined postpartum depression as a major depressive episode, or MDE, with peripartum onset when onset occurs within pregnancy or up to 4 months postpartum. So, postpartum depression is one of the most common complications of childbirth. It has a global prevalence of about 4 to 25%. Most of this occurrence occurs in countries with higher maternal or infant mortality. The US prevalence ranges from about 8 to 20%, with an overall prevalence of 11.5%. The pathophysiology of postpartum depression can be affected by changes to endocrine systems such as the hypothalamic pituitary adrenal axis. So when the HPA axis causes the release of cortisol and also releases catecholamines, which help with stress response. Cortisol is also associated with stress. When you increase cortisol levels, you're increasing stress. So when the HPA axis isn't functioning correctly, it can lead to poor stress response because it decreases the release of those catecholamines. And so these hormones they increase during pregnancy. Some other hormones involved include oxytocin and prolactin. These two are both involved in milk letdown and the synthesis of breast milk. So they've noticed that there's been observations of failure to lactate or unwanted early weaning, and then the onset of postpartum depression. There are a number of risk factors associated with postpartum depression. Those who are younger, African American, on public insurance, are a single mother, have low income, had adverse childhood experiences themselves, or experience intimate partner violence are all important risk factors. Other ones include having a history of depression or bipolar disorder, a history of postpartum depression, multiple pregnancies, or a weak support system. So it's important to know the difference between postpartum depression and what is known as the baby blues. There's a lot of stigma surrounding postpartum depression. Mothers give birth and are expected to be able to bounce back immediately, and oftentimes this doesn't happen. People who are unfamiliar with postpartum depression often confuse it with the less severe baby blues, and there are some important differences between the two. So most notably, baby blues last from anywhere from a few days to a couple weeks, but postpartum depression can last from a few weeks to a year after the baby is born. So some symptoms of postpartum depression are depressed mood or severe mood swings, excessive crying, withdrawal, loss of appetite or increase in appetite, insomnia and fatigue, severe anxiety, panic attacks, or suicidal thoughts. And then the symptoms for baby blues include mood swings, sadness, irritability, crying, appetite problems, and trouble sleeping. So they are very similar, so it's understandable why the confusion happens. But it's good to note that those with postpartum depression, they're going to be more severe symptoms. And it's going to be harder for them to bounce back from it, and they're also going to last longer. And so part of the reason that it's an underdiagnosed problem is because people don't realize that they have it. They think it's just this baby blues, and so they don't seek help. So postpartum depression can have negative consequences for both the mother and child if it's left untreated. It can impact the child's cognitive, behavioral, and emotional development. It can also negatively affect the mother through financial means and then relationships as well. Thankfully, there are various treatments for postpartum depression, and the majority of them are modified from the treatments for major depressive disorder. So this includes selective serotonin reuptake inhibitors, or SSRIs, serotonin norepinephrine reuptake inhibitors, SNRIs, tricyclic antidepressants, or a combination of these. And then there are also psychotherapy options. This is also known as like talk therapy. Pregnancy Risk Assessment Monitoring System, or PRAMS, is a CDC surveillance project that looks at maternal attitudes and experiences before, during, and after pregnancy, and it collects individual state data. So it's being done in each of the states and then condensed at CDC. It's done some great work and it has even prompted legislative actions in some states addressing the problems associated with postpartum depression and other maternal health conditions. So, there are some big public health impacts from postpartum depression. A financial site called Mathematica estimated that postpartum depression costs about $14.2 billion in 2017. So the average of $32,000 for every mother-child pair that's affected but untreated. And so 60% of those costs relate to maternal outcomes and 40% are related to child outcomes. And so the major concerns are the productivity lost. So mothers lose their jobs, aren't as focused at work, and just kind of decline in that aspect. There's also the costs surrounding preterm birth. The majority of those with PPD had a preterm baby. Then there's also maternal health and expenditures. Just the act of giving birth, it's a huge burden and a huge cost for mothers. Postpartum depression is a common disorder that can be effectively treated if diagnosed. However, if left untreated, it can have negative effects on both the mother and the child. It is key to know the signs and symptoms of postpartum depression, and it's important to know that the mother and those around her also know the differences between baby blues and postpartum depression. Sometimes the mother may not realize it herself, but it may be seen by those around her. There's also a need to resources being provided to expecting mothers so they know what the risk factors are for postpartum depression, and it's important that those resources are provided to those who have the high risk factors, so they're aware that they are at risk for this and that there is help available for them should it happen. And here are all of my references that I used.